Hello, everyone. Thank you for joining us. We are scheduled to get started at 5 o'clock, but I'm logging on a little late because it looks like we have a few more participants who are just logging in. So just going to wait another minute or two until they get connected before we get started. So we'll just hold tight for a few more minutes. Thank you, everyone, for your patience. Again, I just noticed a few more logging in. So again, thanks for joining us. We are scheduled to start, we're going to start in a few more minutes because I do see some more who are trying to log in. So we're going to give a few more minutes for those registrants who are logging in, and then we will get started. Thanks for your patience. We just had a few more logging in. So again, thanks for joining us. We're just going to start in another minute or so. I just see a few more logging in. So as soon as those are applicants, or excuse me, registrants are going to be logged in, we will go ahead and get started. So just thanks for waiting for one more minute. All right, I think we're all set. So I think I'm going to kick it off. So again, hello and welcome to today's webinar. My name is Cheryl Bachunas, Assistant Director of Admissions here at Massachusetts College of Pharmacy and Health Sciences, or MCPHS as we often call it for our university, a nice abbreviation there. I oversee the admissions for the Doctor of Nurse Practice program. So if you have any admissions questions, I am your go-to person. And here with me tonight, we have a great group joining us from our nursing team. First, I would like to introduce Dr. Bonnie Laurent, who is our interim associate dean for our graduate programs, the MSN, DNP, and who will introduce the remainder of the team as well.
Good evening, everyone. Thank you for joining us. I'm so happy that you could join us this evening. I just wanted to introduce myself and some of the faculty that I have here with us tonight. So I have been with the university for about 18 years or so, and I've taught across all of the nursing programs. And as Cheryl mentioned, my current role is the interim associate dean of the graduate programs. And I oversee both the master's programs as well as the Doctor of Nursing Practice program. So if you have any questions as far as admissions and applications and those types of things, certainly you can reach out to Cheryl, and you can, any other questions, she can also, reach out to me. I'm happy to speak with you one-on-one or give you more information as well. And so I also teach some of the courses in the DNP program. And with me here tonight, you can see on the slide that there are some additional names here. So this is our core DNP faculty. So Dr. Fatma Matawi, she has been with the university for several years as well, and she teaches some of the research courses in the DNP program. And we have Sylvie Jusset. She also teaches in our BSN and the DNP program, and she teaches the health policy course. And Dr. Donahue, Deirdre Donahue, she teaches the quality course as well. And with us tonight is Dr. Street. Dr. Street, do you want to introduce yourself?
Sure. Hi, everyone, and thanks for joining us tonight. My name is Nancy Street. I'm a pediatric nurse practitioner, and I teach in the Doctor of Nurse Practice program, as well as the FNP and PHMP programs. So it's a pleasure to meet you tonight. My background's in population health. I'm a social epidemiologist, as well as a nurse practitioner. So I teach the population health course in the program and have helped out with the scholarly project courses as well. Welcome.
Thank you, Dr. Street. And Dr. Susan Dana, she teaches in our program and also is one of our DNP alumni. Sue?
Hi there, everyone. Nice to be here and look forward to chatting with you. I'm an adult nurse practitioner, and as Dr. Laurent alluded to, I am an MCPHS DNP alum, so sort of intimately familiar with the program on a couple of different levels. I've recently joined as adjunct faculty in the DNP program, working on the scholarly projects. My background, as I said, is adult nurse practitioner, and my clinical focus has been advanced heart failure through most of my career. And now I'm focusing on primary care and mentoring nurse practitioner residents.
Great. Well, great. Well, this is great. And thanks everyone for the introductions. And as you can see, we've got a great group of faculty here to join us tonight. And we are very excited and pleased to have you here today to present our university's offering through the School of Nursing, Doctor of Nursing Practice program. And just to give you a quick overview of this evening, so during this webinar, we'll discuss information about our university, the program, how to apply, and a student's, or as now alumni's, perspective of the program. So if you do have any questions, please feel free to ask them at the Q&A box in the corner of the screen for us to answer. We'll answer that during the presentation, or if we don't see it, we will answer it or address it after the presentation. And one other quick note is just know that this webinar is being recorded. So if you missed anything or need to log out before the end, we'll be able to send you this link of the webinar after it is completed. Okay, all right, we'll go ahead and get started. So who is MCPHS? MCPHS is a healthcare specialty university offering 100 different programs in different health science fields. The university has been around for a long time, since 1823, starting in Boston. And actually, we just celebrated our 200th year anniversary just 2 years ago. We are the oldest university in Boston. Harvard is actually located in Cambridge, not Boston. So we take that honor and we're very proud of it as well. So we started just as a pharmacy program in Boston, and MCPHS has grown to incorporate over 7,500 diverse students between our 3 campuses, which is located in Boston and Worcester, Massachusetts, and our Manchester, New Hampshire campus, as well as our online branch. We are a teaching university, and healthcare truly is our specialty. Many of our faculty are still working in the healthcare field while also teaching. They are also well-versed in the courses materials, and they constantly are staying up to date with the current healthcare system. So MCPH Online, we have been offering our graduate nursing program since 2009. Originally, they were on campus, and then we introduced our online branch in 2011. Now we have over 35 online programs, and we roughly have 500 total students studying with our online nationwide. Our online programs are flexible, giving you the freedom to continue to working and living your life while going to school. Although the program may be online, our students still access the same resources as our on-campus students do. They have access to state-of-the-art facilities, our faculty advisors, tutoring, career services, the Writing Center, an online library, counseling services, and so on and so forth. So you're not missing a beat. You're still part of the MCPHS community. The online learning experience, what does that look like for this program? So the online program is very flexible, as I mentioned, in that the courses students complete are asynchronous, allowing you to access your course material at any time during the week. So students complete an average of 2 courses per term for this program, and they spend roughly 3 hours per credit each week on coursework. So for example, you're taking 2 courses this fall semester, 3 credits each. That's a total of 6 credits for the fall semester. So plan to carve out about 18 hours a week to study and to complete your coursework. Just something to kind of keep in mind. We use a Blackboard as a tool for online learning. And also please note, you do have flexibility to take 1 course a semester, but just also please note that if you take less than 5 credits a semester, it will impact your financial aid or loans, and it will extend your completion date. Beyond classes, students also partake in experimental clinical, and the experimental clinicals take part in your own community. I'm going to pass this over to Dr. Laurent to talk about this next section.
Sure, thank you. So I want to talk a little bit about the DNP degree. It's one of the newer terminal degrees, and it's specific to nursing, so that makes it somewhat unique. And sometimes there's a little bit of confusion, PhD versus DNP. So this slide just kind of shows you a little bit of the kind of core differences between the two. When we look at the program objectives of the PhD versus DNP, you'll notice that the DNP is practice focused, right? Doctor of Nursing Practice kind of makes sense, but it prepares nurse leaders to utilize evidence to conduct evidence-based practice. And of course, our healthcare, our focus always is to improve patient outcomes, but you're using kind of existing evidence and then looking at, how can we, make changes to improve care. When we look at the PhD program objectives, it's more primary research focused, where you're actually doing your own primary research, and it prepares nurse scientists and scholars to conduct research to advance the science of nursing. And of course, the same outcomes to improve healthcare, but it's more, again, that research focused than it is to use some of the evidence and apply it to the practice setting. When we look at competencies, there's just different, we have guiding organizations that drive curriculum design, and so there's differences there as far as looking at competencies. When we look at the program outcomes, the DNP leads healthcare improvement initiatives via practice, policy change, or organization or systems quality improvement project. And the program outcome for the PhD would be to contribute to healthcare improvements via the development of new knowledge and scholarly work. So again, that primary research. When we look again at the research, we're looking original research for the PhD. Again, DNP applies credible research findings to, the practice setting. And so the focus of the DNP, there's a DNP project versus a dissertation. So we'll talk about that a little bit later on. And again, innovative and evidence-based practice versus PhDs heavily focused on scientific content and research methodology. So those are kind of the basic differences between the two. And you can see that at the bottom of the slide, this comes from the AACN nursing education site. So you always can look for more information on using that link as well. So why should nurses, pursue a DNP degree? Well, when we think about the ever-changing complex healthcare environment, it's really been noted that nurses really need some increased competency and training to really, look at the primary and acute healthcare settings across the nation, really looking from leadership, systems thinking, quality management type of focus. And when we look again at some of our organizations that drive nursing practice, our professional organizations, we have the AACN position statement that supports the DNP as a graduate degree. And also looking at the NOF organization. So NOF is National Organization of Nurse Practitioner Faculties. It's another organization that looks at preparing practitioners. And looking at, how best can we meet the needs again of our healthcare system, and really preparing nurses to care for different populations, and really again, improve outcomes overall globally. And so NOP supports the DNP degree as well. And when we think about other areas of nursing, so for example, on the slide here, I have an example of the accreditation for nurse anesthetists that requires a doctoral degree. So we already have some specialties within nursing that already require entry to be a doctoral degree. And then when you think about it, to be part of that professional healthcare team, a lot of the other healthcare professionals also require that doctoral degree as entry into practice. So it's really to meet the ever-changing needs of our healthcare system in complex settings. So I'm going to talk a little bit about our curriculum and give you a little overview of the program itself. So our focus of our DNP program is that organizational and systems leadership that I mentioned. So when you think about, sometimes caring for patients in your own practice or your own setting, you might be focused on the patient and the family and significant others involved with that patient. But we're now going to be looking at things from more of a systems organizational lens. And so, that's kind of the different broader kind of view that we're going to look at improving patient outcomes on a larger scale, and preparing advanced practice nurses to have, again, more competency with some leadership, quality improvement skills, as well as, again, always aiming to improve those patient outcomes for diverse populations, and also advocacy for policy change as well. So our program starts every fall. We invite a new cohort every fall, and it's approximately 24 months, 36 credits. And as Cheryl mentioned, there is an option to take one course at a time. Again, that would lengthen that time a little bit, the tenure a little bit. And for the DNP degree, there's 1,000 practice hour or clinical hours that are required. However, our program welcomes advanced practice nurses that are already certified, and you already went through your master's program with direct patient care. So 500 of those hours might be able to be applied to those 1,000 hours with approval from myself. And so, typically it would be 500 hours that you would complete for your DNP degree, 500 experiential clinical hours. So this is a list of our curriculum, which, probably isn't going to give you a lot of context. There's a lot of courses listed here, but it kind of gives you an overview of, how the courses unfold. So your first few semesters, you're really taking some core foundational courses that will give you the tools and skills and competencies that you need to then carry out that DNP project that I mentioned. So you'll see, the first 3 semesters are that, and then the last 3, semester 4, 5, and 6, the research translation 1, 2, and 3 have the bulk of those 500 clinical hours that I mentioned, and that's because you're completing your DNP project, with taking the didactic course as well. So early on, you have DNP Foundations, where we talk a lot about, just the degree itself and some of the theory and leadership, and also, kind of overview of the project. And then there's a methods for evidence-based practice course as well. And then the next semester, you have health policy, and then concepts in population health. You'll also notice there's 3 electives here. The first one starting the second semester. And what's unique about our program, I think, is that our electives, being at a health sciences university, you have options to take courses outside of the School of Nursing to just increase your depth of knowledge that's focused on the topic that you choose for your project. And so you have a lot of flexibility and kind of some unique opportunities to take some interprofessional courses. So then you have the second semester as another elective, and then organizational systems leadership for quality improvement, and an informatics and data course. And then, as I mentioned, the last 3 semesters are kind of your core, project courses with that last elective. So these, you can see some of the schools that are options to take elective courses in that I mentioned listed here. So we have the New England School of Acupuncture, we have the School of Healthcare Business, Public Health, School of Healthcare Business and Technology. So again, it just kind of expands those opportunities for you to gain some increased knowledge related to your project topic. So a little bit more information about the clinical hours that I mentioned. So experiential clinical hours in a DNP program are a little bit different than what you might think of your traditional clinical hours that you did for your NP or your BSN, where you're actually doing direct patient care. These hours are where you're carrying out that project. So just for an example, a quality improvement project in a clinical organization, you may, some of those hours will be going in and collecting some data and speaking to stakeholders and other professionals and experts. And then you're going to actually carry out that quality improvement, for an example, project. And so you have those kind of direct hours, but again, it's not the one-on-one like nurse practitioner with a patient. It's really looking at carrying out a systems-focused project. And then you also have some opportunities for indirect hours, so working on that project. And, so for example, preparing an IRB application or synthesizing some information that you extracted from the literature, those types of things. So it's different than what you might think of, like I said, as traditional clinical that you've had a past experience with. But there's several settings or opportunities for your DNP project. It could be in a healthcare organization. It could be in a public health arena. It could be something related, again, to health policy. So, there's really a lot of flexibility, and it depends on what your passion is and your focus of what you want your project to be.
Great. Thank you for that information. So now I'm going to move along and we are going to introduce our guest speaker. And we're very excited to have Dr. Deanna here today. She is a DNP grad from our program and is here to share more about her learning and experience with the DNP program. Dr. Deanna received her BSN from the University of Vermont, her MSN at the University of Connecticut, and her DNP here at MCPHS. She has practiced as a nurse for 38 years and as an APRN, primarily focusing on cardio subspecialties for over 25 years. 10 years were spent in advanced heart failure and pulmonary HTN at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. And in the last year and a half, she's transitioned to the VA Medical Center in White River Junction, Vermont, as a faculty in their primary care nurse practitioner residency program. Dr. Deanna's work in quality has focused on improving patterns in heart failure patients in order to reduce hospital length of stay and hospital readmission. In her new role in the VA, she continues to focus on care of heart failure patients, specifically working to improve care transitions. She is active nationally in the American Association of Heart Failure Nurses, serving as a chair of the Communications Committee and chair of the 2024 Annual Meeting Committee. Hello, Dr. Deanna, and welcome. We're excited to have you join us today. Did I leave anything out or anything else you wanted to share?
No, I forgot that all of that was on there. It makes me sound really, really old.
Oh, no, it
I
sounds
guess,
great. It's very,
I guess,
very impressive.
I guess I'll say seasoned.
Season. Perfect. Sounds great. So we're so good, Glenn. We're so excited to have you here and join us today. So we did want to actually ask you a question. Could you describe that experience and the opportunity of taking electives outside of the School of Nursing and MCPHS, kind of like what Dr. Laurent was just talking about, how that's such a great a part of our curriculum.
Yeah, it really is a unique experience, and I'm not sure it was one that I understood as I was entering the program, but certainly as I was taking the electives, I really understood sort of the richness that it brought to my education. I think most advanced practice nurses are really educated under a nursing model for most of the education, and so classes are often taught mostly by nurses, and there's a language that we all speak, that we all understand. From the time that you step into your first nursing class, but taking those elective classes really broadens the healthcare experience and highlights the interprofessional collaboration that we are really supposed to be embracing to improve or bring the best outcomes to our patients. So it really is so enriching to take classes with sonographers, or pharmacy students to understand the language that they speak and the way that they all think about patient care. So kind of communicating with those students on discussion boards and responding to their different ways of thinking and the different literature that they draw from. And it really helped me understand that we're all looking at things in a little bit different way to take great care of our patients. So I loved it. And I also really enjoyed having different faculty, because again, I think, I learned a different approach to thinking about certain problems, but also hope that, maybe exposed different faculty to our nursing models as well.
Great. That's great and very helpful insight for our prospective students tonight. Terrific. Thanks again for sharing that. So next up, I'm actually going to share is about our admission or application process and the details on how to apply. So the first step is to go to MCPHS, our website, and all you have to do is just Google search MCPHS application and look to submit a graduate application. And this starts the process, and it's going to ask for your general information, name, address, and some of that general information. Again, that's starting your application. The next, once you've completed that piece of it, we will need all of your official transcripts from all colleges attended. So an earned master's in nursing, an advanced nursing practice specialty from a nationally accredited CCNE or ACEN or NLAC programs. And we need transcripts again from all post-secondary institutions. We do require all, even though if you've taken a few that were maybe online or a few college courses or even at community colleges, that information will be needed to complete your application. And we're also, what we're going to be looking for too is that you've earned a GPA of a 3.0 on a 4.0 scale. Also, we will be looking for a personal statement, a recommendation of 750 words or more, and I can send you that prompt. And please note that the paper should be on a title page and references that are not included in the 750 word count. A copy of the current encumbered RN and APRN license and a current national certification in an advanced practice nurse. 2 letters of recommendation, one related to the academic ability, professional competency, and then one related to the leadership potential. And please include on letterhead, original signature, and written within the last year. Also your resume, and then also successfully completion of the prerequisite graduate research method statistics course minimum of a GPA of a grade of a 3.0. And then students are required to complete 1,000 clinical hours as part of the DMP degree completion, a maximum of 500 hours of your preceptor supervised direct care clinical hours earned from a previous master's degree may be eligible or apply to this requirement, and you can just work with the program administrator or the dean's approval, as Dr. Laurent had mentioned earlier. A required interview, and this will be a Zoom virtual interview. And also please note the deadline is August 1st, 2025, and the term start date is September 2nd, 2025. And again, as Dr. Laurent had mentioned earlier, this program is offered every fall term. So if you're not looking to apply this year, we do offer this every fall. Keep in mind as you're looking long term. One of the other requirements is geographical eligibility. So one thing, this is very important. There are certain states in which we can and cannot accept students from into our program. So as of right now, here are the states in which we can accept students from. Unfortunately, each state has their own specific state requirements and regulation. And as a result, we do not offer the DMP in every state today. Tuition and financial aid. So tuition is currently $1,160 per credit hours, and that's not including fees. So the fees for our online students pay is an enrollment deposit, which is currently $500, but just know that that deposit fee of $500 goes towards your first semester's tuition. So there's no loss there. There is a graduation fee, which is currently $330, and any equipment or books may be needed for the program are additional fees. And please note this tuition, of course, is subject to change, so always best to refer to the website for the most up-to-date information. Just Google again, MCPHS, tuition and cost. Once you get to that page, just look on the location and you would be typing in or clicking the tab for online, and you'll be able to see the current credit price. Also note, financial aid is available. You can apply for student at studentaid.gov and add our student code or our school code, excuse me, which is 002165. And you can put in Boston, as this does refer to all locations or all campuses. And also just note, alternative ways to fund the program include applying for private loans, using tuition reimbursements from your workplace, outside scholarships, payment plans, or a combination of these. Funding, we completely understand, is an important piece to take into consideration when looking at this program, but don't let it scare you. Remember, it is an investment in your future and yourself in your career. And MCPHS is actually ranked number 3 for return of investment, which just goes to show you that our students are doing very well for themselves post-graduation. And we have one of the lowest loan rate defaults in the nation, which is greatly encouraged. So as you navigate this process and have any questions, don't hesitate to reach out to me, our student financial aids, or our student financial aid service advisor, Kristen DeRocha. She's just a phone call or an email away, and you're welcome to schedule an appointment with her as well on the website. So if you wanted to take a quick snapshot of this screen, you certainly can. It might be helpful. So at this time, I just wanted to see if anyone had any questions that we could answer. You can certainly put them into our chat. And this brings us to our question and answer session. So as we kind of wait for some students to maybe put some questions in there, I'm going to ask one of the common questions that I do get a lot is, as far as transfer credits, are they allowed? Dr. Laurent or any of the faculty, would you be able to address any of that questions?
For the doctoral program, there really aren't transfer credits because the courses are at a different level. Most students that are in doctoral programs usually stay in that particular program. I'm certainly open to speaking to anyone if they have doctoral credits from another program, but for the most part, the credits and the courses need to be taken at MCPHS.
Thanks for clarifying. And I don't see any more questions, but I'll just ask one more question. And again, if any students have anything they want to ask, please don't hesitate to put it in the chat. But a common question that I'll still get to is, if you do take one course per semester, how long would you have to complete the program? Is it 4 years you must complete it, or what is the true guideline for that?
Sure, that's a great question. So the maximum period of time would be 5 years from the date of enrollment into the program. And the other thing is, if you take one course, it doesn't mean that you have to take one course every single semester. So it's really kind of flexible. And I'm the faculty advisor for all the DNP students as well. And I meet with students at least once a semester and talk about, kind of how are things going and check in, but also talk about, okay, so you had planned on taking, 2 courses next semester. What do you think? Is that feasible? Or maybe, something's going on that you want to drop down to 1, but then the following you go up to 2. So it's not like set that you have to make a decision, for the entire tenure that you're going to be in the program. So you can kind of just see how it goes if you want to start with 2 and then drop down to 1 or vice versa.
That's great. That's great information. Yeah. I don't see any more questions in the chat. So
Can I ask
I
a question?
oh, yes. Go ahead.
Because I think, and maybe like this is a question for Dr. Street and Dr. Laurent, because I do think it comes up and I think, as people are thinking about applying to programs, they wonder, do you have to have an idea about your project while you're applying? Or is it wise to be thinking about a topic or have an area of focus?
That is a wonderful question. And actually with the personal statement essay, one of the prompts is, what might you be thinking about for your DNP project? And it's not that you have to have a definitive plan. You don't really have a lot of information about what that project really involves. And so we understand that. But we want to know what you're passionate about. What do you see maybe for a practice problem or something you want to change in healthcare? And, think about how you would kind of go about that. So there's prompts in the essay that I think would kind of, direct you a little bit to talk about that. But again, you can change your mind, but it is like, that's a good point, because I think it's something that you want to kind of start thinking about. And, sometimes you can kind of Google different DNP projects, see some ideas of what's already been done. Think about what you're seeing in your current practice that might need quote fixing, or something that you want to think about from a different manner. And so I think it's nice, something that you're really passionate about is always good too, because you're going to be working on this for, a couple of years. So I think, again, it's not that you have to have a definitive, specific idea, but it's a broad kind of idea for a topic is what's important to have probably as you start.
And some of the coursework that you take along the way can help you kind of forge ahead and maybe adapt a project or adapt an idea in a different lens. Like when we teach, with the population health course, some students have been thinking about a clinical problem and then they scale it up to think more of a community level or population level problem and might analyze it from that lens. But also, Dr. Deanna, as you mentioned, being exposed to classes in public health or in healthcare business administration, it can actually, again, guide your thinking about how your project might evolve. And we're here to support you and to guide you and to learn together. It's really quite exciting.
That's terrific.
The other thing I just wanted to mention is, I think some of the other common questions that I can think of is, managing a doctoral program with life, right, outside of academia. And so, it's a decision always, is this a good time to, embark on that endeavor? But I can tell you that, from personal experience, having a DNP and gone through another DNP program, and that it's so worth it. I think that it really just opens your mind. It gives you different perspectives at a different level, and absolutely worth it. Is it rigorous? Yes. We talked a little bit about, the hours per credit and those types of things. In the hours, as you saw towards the end of the program, but again, those are not all at the clinical setting. So I don't know, Sue, if you have anything to add from a student perspective, because that's the question that I hear a lot, when I meet with prospective students, is just the manageability of the program.
From my perspective, this program was initially, for me, I had been out of doing anything academic for a couple of decades, and there was no online platform or online learning. So I do have to say, it was a learning curve for me, to negotiate all of that and to get back into writing again. Writing is a skill that if you don't use it, you lose it, and you have to exercise it pretty regularly. So, but once I got warmed up, I think the workload was really, really manageable. And it became just a lot of fun, to interact with other students and really feel like I was catching myself up on all of the things that I hadn't thought about for a really long time. So there were a lot of new developments in healthcare since I had been in school. So I think it was really manageable, but I do think that there were times where I had to be really honest with myself about, what I could do. I was a working mom and had, a daughter in finishing high school and college at the time. So you want to be present for all parts of your life and, really try to think about how much can you really fit in. We like to think that we're all super people, but we're we're mere mortals and have to be really realistic about what we can do and what we want to accomplish and set reasonable goals for ourselves. But I found it manageable, and I found the faculty incredibly supportive of all adult learning. And just really very supportive of me and my journey. And, working with students now, I find the faculty very supportive of all students and, meeting them where they're at in order to help them meet their goals.
That's terrific. That's great. Excellent. Was there any other last minute questions between faculty, between any of our registered guests? I think this is an excellent way to end it. Thank you again, all the faculty, for coming and sharing all of your insight and knowledge about this program, and also our prospective students for joining us this evening. This is our contact information. Please take a snapshot of it. However, please note that I will be sending out a recording of this webinar that'll have our contact information. So if you do have more questions down the road as you look into this more, please feel free to reach out. But I will be sending that as soon as I get that recording, which should hopefully maybe be by the end of the week, if not early next week. So thanks again for everyone for joining us this evening, and enjoy the rest of the evening. And we look forward to having possibly hear from you soon. Take care.